pretty intense right now. It just feels pretty weak. It doesn't hurt as bad when I'm coming up right here. I'm okay. Coming up, it's a lot easier. It doesn't feel as weak.
So what I'm looking for is I'm trying to find where it is the most painful for her. So as I go through this, where does it feel the most uncomfortable? And if I'm not hitting a spot that isn't,
No, it's not bad right now.
okay, so I'm gonna look for a different area. But that gives us a starting point.
Set you down in there.
So that's actually right on her MCL. Meniscus is right in through there between the femur and the tibia, right along her MCL. So she very well may have had an MCL sprain or a meniscus tear, meniscus injury, but we're still going to go in that same spot and scrape where it's most uncomfortable.
It's a little uncomfortable when you do that.
So what we're going to do is hang out in that spot. You can see where it's starting to turn a little red. And even if I go like that, you can feel that it's swollen and inflamed. So we're going to hang out in that spot until she tells us that most of the pain has really decreased.
So you could tell that I wasn't faking it.
You actually have some swelling in there.
That's a little uncomfortable.
And so that's where I want to stay. Now, within reason, I don't want her to have tears,
I'm not.
but that tells me where to go. And then after we do this, we'll have her retest the squat. So what are you feeling on your end?
It's still sore. I think I'm getting used to doing that. It's still sore, not as bad as it was when you first started.
The whole premise of this is to increase blood flow into the area, help with the healing process. She obviously has an inflammatory process going on because you can just see and feel that puffiness in there from where something was sprained or strained. Especially compared to her right side, you just don't see that or feel it. So now I'm starting to go as she gets used to it and it starts to soften up, I'm starting to use more pressure. Not a ton of pressure, ounces, not pounds. That's a nice crunchy spot.
What causes the crunchiness?
Inflammation. If you zoom in there, you can see that petechiae. It doesn't always correlate to where the pain is, but a lot of times it will. And you don't have to see the petechiae or the hickey to have this be effective. But as I go through there, in this direction, I can feel that it's much smoother.
It doesn't hurt as bad when I'm coming up right here. I'm okay. Coming up, it's a lot easier. It doesn't feel as weak.
Do you feel it anywhere else? So when you come down, is it more in the back?
Right
back in there?
Uh-huh. A little, mild.
So right now where she feels it also, this is called your popliteal fossa, which is basically the armpit of your knee. You can feel back there that it's a little thick and boggy. That's from the inflammation. I go over here and compare to the other side. It feels nice, soft, and supple. But on the left, you can feel where it's just, especially right there, that's probably not very comfortable. So that's where we'll go next. So when she was squatting down, she could still feel a pressure in the back of the knee. Again, this is your popliteal fossa, the armpit of the knee. Feel right in through there, your flinch. Now, here's the other side. I'll use twice as much pressure. It's probably not comfortable, but it's not a jump like that. So that tells me exactly where to go. This is going to be the junction of where the hamstrings come down and where the calf and gastroc come up, and they blend together. So all I'm going to do is search for the area that feels tight, and on her end, I'm basically going in that same spot that I was palpating that was uncomfortable. When somebody has pain in the back of the knee, you can have two very common situations that cause it. One is a true injury to the back of the knee, so somebody hyperextends their knee, strains their hamstrings, that will cause pain back here. But the other thing that can happen is general swelling from somewhere else in the knee, and that swelling internally will push back here and it'll puff it up. The swelling is like water. It will try to follow the path of least resistance. So as I go through here, and I've been doing this for a few minutes, I can feel the sides, the outside and the inside have started to soften up, but in the middle there, it's better than what it was, but that's still the part that's sticking out, is right in through there. Now, at least when I strum on it, I don't expect it to be perfect, but she's not jumping, she's not flinching. So that's a good sign. You got a good example of some petechiae there. Basically a hickey, turns into a bruise, goes away, everybody's fine. But again, that'll turn into a bruise and go away. That is just petechiae. It's the blood vessels underneath the skin, the little capillaries that are bursting from the tension, so it's okay. Body will go in, heal that, it'll go away. But now as I go through here, much more supple. So what we'll have is the squat.
Better. Much better. They both feel better.
Very brief, simple demonstration of how we use muscle scraping and gua sha on an acute knee injury and how much it can help in just a matter of 15 to 20 minutes.